All right. Hello, everybody. I am Rebecca Piercy here at our beautiful location in Orange County, Bear Bunny Aesthetics. And this is our lovely nurse, Ardell, the needle nurse. She is a master at what she does. And this is our beautiful patient, Mikai. Michelle goes by Mikai. We brought Mikai in today to do a cellular therapy treatment. We're so excited to have her in. Mikai has been trying to get pregnant, has gone through 3 rounds of IVF, and we have done she's done exosome IV therapy, which has had great results. But today I'm so excited to bring you in because, well, she's already so beautiful, doesn't need anything done. But one of my favorite treatments to do, our motto here is fight for natural beauty. So I love anything we can do natural to stay youthful, young, and young forever, and reverse aging. So we are doing one of my favorite treatments, an EXM extracellular matrix treatment to lengthen her telomeres, reverse aging, and we're going to fill in some areas of elasticity underneath her eyes. I love this treatment. I chose this treatment today, or we chose this treatment today because it's safe. Not only is it safe for trying to get pregnant while she's going through IVF, but it's going to help every area of her body. The cells aren't going to just stay put right where we put them. We're going to create a controlled injury, underneath your dermis there, or they're going to stay there for a little while and fill in the area of elasticity and really fire up your own growth factors. But I like to call them little nanobots. They're going to go where they need to go in the body to promote rejuvenation and hopefully re-stimulate those eggs and ovaries and make all of her dreams come true. But we pre-treated Mikai today with endermology, which is a lymphatic drainage treatment. You can do that with your hand stimulation. It's just really reactivating your cells. I love to do endermology over the whole body when we're doing any body treatment. Today we chose to do her face, and then we also did an IV. It is really important for your cells to be hydrated. So that way a cellular therapy treatment is going to activate your own cells in your body. And when you're hydrated, it's going to really send them and tell them where to go. So we did her vitamin IV treatment. Didn't use glutathione. I like to stay away from anything anti-inflammatory before a treatment like this and after. So I love to make sure all of our clients have pre-care and aftercare. Pre-care is really simple. It's just making sure you're off any anti-inflammatories that, because we want that inflammation there, right? Today, after talking to you, Mikai, we found out that you've been having some hip pain, right? Correct? Ardell's recommendation, she doesn't think we're going to need the full 2 cc's on your face. So anything left over, we can go ahead and inject intramuscularly into your hip. Pre-treatment's pretty basic, like you already did. We talked about your vitamins. I like to just stay away from any fish oils, any anti-inflammatory. Just for the first few days, no medications, no steroids. If you're on any steroids, I like to wait at least 6 weeks. So today we chose the cellular therapy over the exosome therapy. We've done 3 exosome therapy treatments. You've done 3 of those already. The cellular therapy treatment that we chose today, I think is going to be best for you. Okay, Mikai, here is your beautiful cellular matrix product. Here you go. I'm going to have you hold it in your hand. I love to just think about it and really send some gratitude to where it came from. My favorite part about the products we use, there's so many different products out there, but I've been doing this for 17 years. And this product that we use comes from a beautiful lab in Utah. Mothers are between 18 and 25, pre-planned C-section birth. The doctor that created this product, one of my favorite things, it has over 85% living cells in it after defrosting. It takes about 3 minutes to defrost. So these living cells are going to take off in your body and, bless your body. So just take a moment and think about it, put some intention on where you want them to go and, and do. The testing on this also, we talked about this because I won't put anything in my body or my patient's body or anybody else's body that hasn't been really, just thoroughly tested. The genetic testing, they check the mother and the father, the grandparents and the great grandparents. Even if somebody's vaped or had a tattoo, they throw it away. The viruses that are tested, the bacteria, fungus, it's the purest product I've ever found. So let's talk about dosing. How do we decide how much to do, how much is enough? Our patient here today, her main concern was the less elasticity underneath her eyes. So after discussing it or with Ardell, she's beautiful, doesn't need anything as is, right? But we all want a little glow up and look a little bit better. So she's not going to need more than 1.5 cc's underneath her eyes, but that's recommended dosing based off of the doctor, the nurse that's doing the treatment. We have an extra 0.5 cc to, bless her body with. And based off of our consultation, Vika, you have some pain going on in your right hip, right, from a previous surgery. So I like to say the cellular therapy treatment, they're like little nanobots, right? They're going to know where to go in the body, where the inflammation is. So with that other half a cc, we're going to put it as close as we can intramuscularly to her injury. And some people say, well, if they're little nanobots, does it really even matter where you put it, right? They're going to go there. Yes, this is true, but if we have a little extra, right, or if we can spread it out, I like to do that, but it's based off of any doctor's recommendation or what you decide to do, you know, as a physician on your own. How you decide under each eye is completely based off. This is why Nurse Ardell is the professional there. It is definitely the nurse's eye. It's all about having a good injector that's going to see. The nice thing about a cellular therapy treatment, or a lot of people do PRP or PRFM, and some people even mix these. I don't think you really, it's up to you. It's, you know, this is the fun. That's why they call it a practice of figuring out what's going to work better. This is the purest, most beautiful product. I personally, we don't like to mess with it here. I want to just get this into the body as is. Some people may need a little bit more, a little bit less on one side of the eye, depending on areas of lost elasticity, right? Not everybody is as symmetrical as we'd like to be. So, but the good thing about this product, you can't overfill. Even if you feel a little puffy, your body is going to absorb it, and it's going to be a send off and go wherever it needs to go in the body. And as a matter of fact, right after a treatment like this, the patient may even look a little overfilled and puffy. That's fine, because it is not a filler. This is a natural tissue that's already found in our bodies. And what I've noticed even with this treatment, even though we're just injecting it, you know, like you would a filler under the eyes, it's going to affect all areas of the skin. It's going to help increase the elasticity, the collagen, and the natural hyaluronic acid in her skin by quite a bit. So let's get started. Looks like we're ready to go. Just maybe another minute. So you know when you're ready to go, I like to have the patient warm this in their hands. Always, you know, send them off with a good intention or a little prayer, but you can do as you wish. Takes about 3 to 5 minutes, and you'll know when you don't see any of those little crystals in there that it's ready to go. It has a nice little pinkish color to it, as exosomes are clear, but this cellular therapy treatment, you know, you're getting all of that perinatal tissue, so that's why it's pink. You don't want to manipulate it too much. We don't, but you know, you can just move it around. Just want to treat them gentle, and as soon as those little icicles are ready to go, we'll get started. So another minute here. While we're waiting, Ardell, will you tell us what you're using?
If we look at our patient here, if you can look up to the ceiling for me, this is where we can see the hollowing that she's having. So this is kind of how we dictate how much we want to put of the EXM into her eyes. The best way to deliver the product into this area is to use a cannula. So I use a 25 gauge 2-inch cannula. This is best just to get into like right here in the hollows as well. And also because of the consistency of the product, it's a little bit easier to control instead of going through with like a direct injection.
On that note, I thought of something else I wanted to share. The 25 gauge cannula is perfect. That's why this is such a great treatment for underneath the eyes. Based off of studies with the size of the cell, you want to use nothing smaller than a 25 gauge cannula, or if you're injecting IM, nothing smaller than a 25. 25 or 23 is recommended, so that's perfect. Otherwise, you'll just be putting too much pressure on the cell, and that could damage them, and that's what we don't want to do. We don't want to manipulate it at all. So as you can see, we're ready to go. You do see a little bit of the tissue. This is a fully filtered product. That is totally normal to see that. So
yes.
Are you ready? Good. Ardell is drawing out these beautiful cells here with a 16 gauge needle. I like to use the angle, that way you can get every last drop at the bottom of that, you know, no cell left behind. Then she's going to go ahead and put her cannula on and get rid of those air bubbles. Best way to get rid of the air bubbles is without the needle on, that way you don't waste any of that product.
Relax. So what I'm going to do first is create just like a little pilot hole. So I'm going to poke with the needle, a little prick, and then I will slide the cannula through there. So we want to get the cannula right into like the deep dermis. So I don't know if you can see here, when I lift my cannula, we can see where it's at, but you don't really see the gray of the cannula. So that's exactly the plane that we want to be in. And then we're just going to inject very, very slowly. I just kind of want to deposit a little evenly here. And with cannula, we always want to feather so that we don't bolus the product into one specific area. And then Mikai, if I can just have you look up to the ceiling for me. And then sometimes you want to do this with your patient so you know exactly where the hollowing is.
And I love how this treatment works because we are creating this controlled injury right underneath the skin, right, with the poke of the needle. So that's why these cells stay put for a little while, because we did just poke around right underneath there. So we're activating her own body's growth factors. So now her own body are sending healing growth factors there, and these cells are going in there and really duplicating.
1, 2, 3, pinch.
You could ask her about
I'm going, Mikai. All right, we're off to the races here. Onto the second side. Mikai, can you tell us a little bit how did that feel? How are you feeling?
Really easy. Yeah.
Surprising? Okay,
Yeah.
good.
So we're doing the second side here. So again, we're going to place the cannula through the pilot hole. So as we advance the cannula, we'll feel a little bit of resistance, but it's going to feel like a pretty easy push through. So that's how you know you're in the right plane.
Wow, that is so awesome. You can really just get right up in there.
Yeah. So when you lift your cannula, you do want to see it, but if you are seeing the gray of that, you are too superficial. So then want to place right into the corner of the eye. And as we push the product through, we're just going to watch how the skin reacts. So because we are in the deep dermis, we'll see the product kind of lift up the skin. And with cannula, we're always going to be feathering. So you're always advancing to avoid doing like a bolus in one area. We want to do just little amounts in each area that she needs.
Now I see why you chose 1.5 cc's for underneath her eyes, because you can really get a lot in there with that.
And then I'll have you look up for me. Just go to the area. I feel like she needs just a little more right there. So we're going to advance the cannula. Make sure in the right spot right there. And we'll always push a little and then retrograde out. And continue that. We're done.
Wow. And again, this isn't a filler, so with a filler you would never have that puffy, maybe the swelling, right? Can you explain that a little bit?
So with the EXM, it's okay to see that puffiness because we want to be in that deep dermis plane. After we inject, we don't want to massage the product into the area as well. So that's kind of where it's different from filler. Filler, we would kind of massage that in, get that in, make sure there's no bumps. But here, the patient will kind of experience a little bit of swelling, but after a couple days, it will settle out. And then kind of return to where it's flat, and then you'll see the improvement in the hollowing after a couple weeks.
And we love swelling when it comes to aesthetic when you're working with a cellular therapy treatment, because that means we've created that inflammation underneath that skin. It's going to keep those cells there, and your body creating its own growth factors and creating this, own healing mode. That way we can really fire up that lost elasticity, lost collagen, and give this beautiful lady one of the best treatments she's ever had. That's how I feel about this treatment. It doesn't compare. A lot of people will ask me, well, why would you use this compared to a PRP or PRFM, which we've done a lot here. PRP is something that is coming from the patient's own body. Problem is, as we age, half of our growth factors are gone by the time we're 18. You can imagine what that number looks like at 30, and then 40 and 50. There's just not enough growth factors in there to create what we're creating with this product. The amount of growth factors in living cells just created human life, right, in 40 weeks. And we're taking all of those cells and placing them in areas of, lost elasticity, sending them on their way in your body where they're just going to create some amazing things. So since we have a little leftover product, Ardell, we'll talk about where that's going next. We have about a half a cc, and we're going to be doing this intramuscularly on your right hip. So you're good with the fan? You said no burning, which is great. Sometimes because of the coldness, patients can experience just an uncomfortable pressure kind of feeling. So I always like to give a little fan. So tell me how you're feeling.
Oh, good.
Yeah. Okay. Well, what you can expect now, a couple days of swelling like Ardell talked to you about, what we've really noticed with this treatment, you're not going to just get results underneath the eyes by filling up that area of lost elasticity. I think if we can do things natural, this is no Band-Aid, this is really turning back time. So you're not just going to experience a more youthful appearance underneath your eyes, you're actually going to feel it all over your whole face. The discoloration, the pigmentation is going to even out. So it's working so even out those melanocytes, and you're going to notice the fine lines and wrinkles. Just overall texture and appearance is going to look better. So yeah, I'm excited for your results. No rubbing the area, just let it naturally stay there. No sleeping on your face. We don't want to manipulate the cells in any way. If you need to do ice, you can do ice for just a few seconds in the area down here. This is the only area that you should feel where the injection was, where we made the pilot hole. Any sort of pain, we don't put any ice anywhere on your eyes. No additional sources of heat, so no sauna, no jacuzzi. Just stay away from anything that you think would manipulate those cells. We're going to keep you off all of your anti-inflammatories because we want to keep the inflammation exactly where it's at. One thing I want to bring up, a lot of people will be like, well, if they're little nanobots and they're going to go to the area of inflammation in your body, why does it matter where we put them? We are treating you aesthetically. We didn't need any more in your face. And even though we talk about you can't really overfill, you can put too much fluid in a face, right? We had a little bit left over, and you said that you had some hip pain before based off of an old surgery. So Ardell, I went ahead and we filled up the last of that. When you're injecting any sort of cellular therapy treatment, nice and slow is the best way. It's just a very slow push, like kind of pushing a vacuum. You're just going to let it, kind of go where it needs to go. You can really feel flow coming out. You don't want to overdo it too fast.
Yeah. Okay, so our patient here is experiencing a little bit of hip pain from a previous surgery. So in this area, I kind of want to go towards her glutes. And the best way to find where you want to inject is breaking up the glute into 4 quadrants. And we want to stay in that upper right corner here. So I just want to palpate for where her muscles are. Right here. Okay, and we're going to inject here a little quick. Then we're just going to push very slowly. You can go in little increments here. Okay, that's it. We are done. When you do an IM injection, a patient can kind of feel some sort of muscle cramp. So just want to kind of keep them laying down or in a comfortable position just in case they do experience that. And then again, we don't want to massage or kind of work the product into the muscle as well. We just leave it as is. You are done. How do you feel?
Oh, great.
Mm-hmm.
Oh, good. I'm going to leave you lying down, but I'll sit you up in a little comfortable position. All right. So Mikai, the same applies to the IM injection we just did to your face. There's no working out, no sweating. Now you have to just Netflix and chill. I tell patients that just listen to your body. It's really a normal thing right after to feel really tired. It's your body going into repair and recovery and doing some work, which is really exciting. That's what we want to see. So listen to your body. Don't push it. Let these cells just activate and reactivate your cells. If you have any questions, you just give us a ring, but I think you're going to be feeling great.
Thank you.
Welcome.
Thrilled.